Okay, so we're looking at behavior assessment. We're gonna be talking about what does that look like when we actually take in a client, right? When we take in a client, or what are we trying to understand? What are we trying to do? Where are we gathering information from? What do we use in practice to implement? Things of that nature, and some issues that can come about. All right, so the first thing we want to understand is, in our minds, we will understand excess and deficits. All right? Excess and deficits. If we have a basic understanding about human psychology, we understand that there's a homeostasis, and that each human being has a balancing point, right? So we know that people want correct body temperature, correct sensations of pleasures, not too much stimulation, not too understimulated. So we want to try to identify, hey, what is lacking here and what is too much with this individual? Right? Something we want to ponder on. Why does this person need to have something? Do they possess something that is too much? Do they possess something that is too little? What are they lacking in terms of what? Something that creates drive or motivation, and ultimately stimulus. Why is this particular energy directed to create this particular drive to do this behavior? Right? Why are they motivated to transfer their energy for this particular behavior? And why are they even stimulated in the first point? Right? Why does it actually happen? What is it about this individual? Maybe we could do basic things, and we could say, hey, let me just work on some observation first. Let's say one, or we extract this information, we say maybe a teacher or a parent, right? Someone who either has great observation, maybe even friends, right? Maybe even other students. But we could think of, we have to extract this information by gathering some observable information. We probably want to observe it ourselves, but we do want to get some information from those who are closest to our client. And if you're lucky, you're in a position to have the observation, so I can look at each and every one here, because I observe you every classroom, and I say, figured you out. Figured out each and every one of you in this classroom. What drives you, motivates you, what doesn't drive you, what doesn't motivate you. What goes on in your life behind closed doors. Right? It takes skill, but over time you will develop it. Right? So we can just have basic observable information to say, what can I see just on the onset? What can I see with my two eyes, my ears, my own senses? To say, okay, I see certain tics, certain things, and now I say, here are some physical manifestations, right? Physical manifestations. I can observe and I can talk. I say, physical manifestations, body language. What is the body language of this individual that I'm observing? Maybe I can ask a series of questions, casual, kind of like we're friends, right? And say, hey, what's the eye movement? What are the gestures? Do I see stimulation? Do I see anxiousness? Do I see confusion? What do I observe? Bless you. So we want to understand, hey, what is lacking? What is in surplus? From there, we want to say, well, we need to have measurable terms, right? Great that we can observe this these phenomena of physical manifestation, but we want to have measurable terms. What do I mean by that? I'm going to say, well, I've identified some issues with behavior. Now I have to go back and do the research and say, how do I even itemize or measure these particular things, right? Scales, right? We say from 1 to 5, how would you describe this, right? How would you describe anxiousness? How would you describe attention? How would you describe sociability? All sorts of things go with that, right? So we want to have something that's measurable in our mind, readily on hand. Next, we want to understand the antecedents and causes. Right? When we say antecedents, we think in things that happen before the behavior that probably causes the behavior in an immediate sense. The antecedents may be different than the root causes. If we say we want to try to hypothesize why something happens, but that could be an ancient thing. That could have happened at 2 years old, 1 year old, 3 years old, all sorts of things. Fixations during childhood, early childhood, but it doesn't necessarily tangle into the antecedents and causes, which are really immediate environment. What are conditions that have to be met in order to facilitate and trigger a behavior, a specific target behavior? All right, so we say conditions. What are the conditions? What are the conditions? And you could break this up into many components. Say, hey, conditions is time. Do you, on a personal level, exhibit certain behaviors repeatedly at different times of the day? Are there nagging, pressing issues that you deal with that only present themselves and manifest at different times of the day? Is it nighttime? Is it evening? Is it morning? Right? Are the conditions people, individual? Like, hey, I'm in a relationship and the conditions are met because of this person. So I exhibit anxiety or stress or neuroticism with this person I'm in a relationship with. Right? You're like, oh, interesting. Okay, so conditions is person, right? Other things, it could be surrounded by family, it could be school, it could be work, it could be all sorts of things, right? But here, if we're maybe even discussing children, we could say, what are the conditions? Maybe they're social, right? Hey, it only happens when another kid is around. B, it only happens when sugar is present, or blood glucose level goes up, sugar spikes. Maybe it only happens with certain sounds, right? What are the conditions? What are the environment that can trigger that particular behavior? And then we can come up with the hypothesis, right? We say the hypothesis is, why do I think this happens? What are the root causes? Right? Typically, we can only extract that information from parents. And we want to find out early experiences of the person, or it could come from them themselves. So we can kind of gather some information to come up with a hypothesis. Doesn't mean that we're right. Oftentimes we are very, very wrong about our hypothesis, and even our conclusions. Right? Okay, so intake. Remember, we're using evidence-based interventions. Unfortunately, we can't just come up all the time with very creative, innovative, novel ways of helping clients. Doesn't work that way because we are within a profession, we have guidelines. There's a lot of issues when it comes to ethical things, things we can and cannot do. I mean, obviously you're under the susceptibility of lawsuits, right, malpractice, all sorts of things, right, insurance issues too. Right? So we say we take in an individual, we call that intake, and what are we trying to do? Basic information, who are you, how old are you, tell me a little bit about yourself, what grade are you in, right? What are some of the things you like to do? Who are your parents? If we're dealing with a child, these would be some of our basic questions, right? And then further we go into, once we've gathered all that information in, and now we start to proceed with our actual job, we're starting to look at how to properly assess. Now we said we really can only assess using the DSM, right? So who here is familiar with the DSM? Everyone's familiar with the DSM? Okay, so DSM is the Bible for us, right? And you're not really deviating from the DSM. The DSM has all the classifications of disorders, and it gives you the criteria in order to fulfill or meet that actual diagnosis. And so when we speak casually, you're like, hey man, I think, what's his name, got ADD, right? Or I think my kid got ADHD, or I think somebody has autism, right? You'd be like, hey, that sounds wonderful in some casual talk, but in reality, if we were to go to the DSM and see the criteria in order to meet those particular disorders, we'd be like, nah, actually they don't, because they don't fulfill all the requirements, right? They're missing quite a few. So it takes time. It takes a lot of time in order for us to properly assess someone with an accurate diagnosis. And this is particularly important because we're dealing with insurance companies. Most time people pay for our services with medical insurance, right? So the medical insurance companies have to really be properly vetting us to see that we come up with a proper diagnosis so they know how to charge for medication, things of that nature dealing with that particular disorder. But things essentially have to go by the book, right? So we're using the DSM. Now, what do we use in terms of identifying some of the criteria, right? We use things such as the SCID, right? Structured Clinical Interview, which is in essence questions, right? So for each specific disorder, there are structured interview questions that we want to be asking in order to facilitate the fulfillment of that disorder, right? For us to get to some sort of semblance of, is this pretty accurate in what I think I'm observing here in terms of behavior, right? In terms of the potential disorder. So each disorder has specific questions you want to ask, right? But we can ask them in different ways, and there's different interview processes. Now the problems with the DSM, right? Big problem is, hey, this sounds pretty easily. It sounds like 1, 2, 3, but really we're lacking a lot of information. The DSM doesn't really consider a lot of cultural components, which has always have been an issue. You say, we live in the United States and there's people here from the eastern part of planet Earth, right? And the DSM is derived from philosophy and psychology, particularly from the Western world, European, white, male philosophers and psychologists, right? Like, well, who were they studying when they first came up with all of these intricate details about behavior in the human mind? Well, they were studying middle to upper class white men, right? And then you say later on in history, then it opened up to maybe white women. Later on past that, it began to open up into ethnic minorities. But we say it's not really universally inclusive. In terms of how does one's impression or perception of the thing that they do is different based on their culture, right? When we say culture, we say, hey, some different stuff we're dealing here. What's your sexual orientation? That may play a role, right? What is your religion and faith? That may play a role too. right? In terms of your impression about the world itself, your perceptions, right? What is your age group? Are you 90 years old or are you 5 years old, right? What is your ethnic background? What language do you speak natively, right? All sorts of things. Because we know that social items play a heavy role in how we all see and view the world. We all come from different backgrounds. So there have been problems with the DSM in terms of DSM not completely being a holistic, conceptual sort of framework for identifying these things. Not perfect by any means, but it may be the best of what we get right now. So we're gonna have to work with that. And then problems with diagnoses, like I said, we have to meet the criteria. Depending on what the issue is, there are different criteria. There's even different severities, right? We could say degree of which, in terms of mild, moderate, severe. So if you do say, oh, I have attention deficit, well, you have it in a light form, a moderate form, or a severe form, right? And how do we go about properly assessing that? Are we over-diagnosing? Are we being a little bit too overbearing or a little bit too light towards the assessment? These are issues that could come up. Let's see, I think I have a structured clinical interview question here. All right, so here's some structured interview questions to meet the criteria for the DSM. So we're looking at PTSD in past year, we're looking at some anxiety disorders, right? So we're looking at post-traumatic relative to anxiety. Here's a question: if trauma has occurred in the past year, since the trauma, and then we're looking at trauma occurred prior to past year. Have you had trouble sleeping? What kind of trouble, right? And we say difficulty falling or staying asleep. Have you been unusually irritable? What about outbursts of angers, irritability or outbursts of angers? We can say we put that on a Likert scale, right? Degree of which 1 is not that bad, maybe 4 or 5 is extremely bad. Have you had trouble concentrating, right? What's your difficulty in concentrating? Have you been watchful or on guard even when there was no reason to be, right? So they call that hypervigilance. Have you been jumpy or easily startled, like by sudden noises? Right, so think of it, we're maybe assessing, getting away from a child, think of maybe assessing a veteran, right? So we just think of a military veteran, someone who's went through some sort of military exercises or some war or conflict of that nature. Maybe they've seen some of their comrades die, maybe they've had to execute people themselves, neutralize the threats, right? These are some of the questions we would be thinking to ask them, right? We're looking at concentration, hypervigilance, and exaggerated startle responses. Why are you so jumpy or startled by sudden noises? How bad are you startled? Things of that nature. That makes sense? Yeah. Okay. All right, let's see, there's and here's some general ones from, what is this, from our textbook, page 230, all right? We're looking at some items here. Below are some items that may be a problem for you. If you have concerns in any of these areas, please check a box next to it. So this could be part of our intake process, and we could have an individual begin to start check off boxes of a problem, something that they believe is a problem to themselves, right? And so they say, hey, is food a problem for you? You're like, not really. Or maybe it is. I'm gonna eat a bunch of junk food. Very interesting. I'll use so much junk food. Let's try to, maybe there's something I need to pay attention to, right? Clothing, housing. Do you have a proper place to live, right? If you don't, you're like, oh, that seems pretty stressful. You don't have anywhere to live. Maybe there's something I should pay attention to. Proper clothing. Do you feel good self-esteem about your physical appearance, right? Money, right? Money is obviously a stressor for most, and especially in this culture and society. Family, what is your family like? Do you talk to them? You don't talk to them? If you don't talk to them, how come you don't talk to them, right? Maybe it's something I should pay attention to, maybe a little further into, right? Job, are you working? Are you employed? If you do not, and I say idle time, idle mind, self-esteem issues, right? Don't feel like you are completing tasks or achievement in your life. Thus, we should look into that. School is more than just education. For the most part, this is a social experiment for you, which means you're probably learning most from interacting with each other than listening to boring professors all day, right? So we say it's important from a social standpoint. Are you in school? Physical health, right? When we think of physical health, somatic symptoms, right? We think of physical body symptoms due to your mental issues that you may be facing are posed by either you have actual illnesses, physical ones, and that causes you to have sort of mental symptoms, or opposite. There's your mental symptoms cause your somatic symptoms, right? Are you catching colds and all sorts of health issues because you're having some mental stress, anger, anxiety, whatever. Feeling lonely, we know that's a big one, right? We're social animals, human beings are social animals, so feeling lonely, we know that it can cause great distress because we are not meant to be alone, right? Whether we like it or not. Sex, right? Too much, too little, stress about it, right? We know that this is basic physiological need. It's something that we may have to pay attention to. Perversions, right? Try to figure out what those are about, where they come from. Police or courts. Legal systems, right? You're going through legal things, maybe you're at risk of your own freedom. That can be an issue as well too. Drugs and alcohol, right? We say you're taking things to facilitate covering up something. You need to feel good, and drugs make you feel good, and alcohol, how come you don't feel good without the drugs or alcohol? Right? What is the reasoning behind not feeling good without those things? Trouble sleeping, why? Are you thinking too much? What is the issue going on? Trouble sleeping, is it nightmares, is it dreams? What are the symptoms with that? Nervousness, anxiety, nervousness about what? Why are you nervous? Why are you anxious? Right? Once again, is it neurotic? You're an overthinker and you cause yourself to be nervous for no reason. Why do you have those impressions about those things you think? Why do you give them so much value in order for them to cause you anxiety? Physical violence. Big one, right? Probably one of the biggest ones because you can't really escape. Verbal abuse is one thing, but physical violence is something that impedes your own basic human right to your own physical body, right? Get confused about things. Confused why? Are you having memory issues? Is it because of anxiety? Why can't you focus, right? Difficulty showing emotions. Right? How come you don't have emotions? Well, is it because of your family? Is it attachment theories, right? My mom never hugged me or loved me, and thus I don't care to have emotion towards me. I can care less. Are you a sociopath? Are you a psychopath, right? Can we see some of these manifestations? Can't make decisions, which is a very common one, right? We call it analysis paralysis. right? You can't properly analyze things to make a choice or a decision, what we call choice anxiety or decision paralysis of some sort, right? Eating, smoking, headaches, right? Feeling down or blue, fears, and others, right? Fear is a big one. Fear about what? Because fear deals with the probability and likelihood of our expectations about the future, right? So why do you have low probability, low likelihood? How do you run that analysis in your brain that causes you to have fear about the uncertainties of the future? Where's that come from? All right, so we're gonna have some basic checklists, kind of what we just looked at now, right? BDI, the Beck's depression. We're looking at things that could potentially cause depression, all sorts of itemizations about attitudes towards things, right? Why are you feeling down? Why do you feel blue? Right? What's your attitude towards things in life that you go through, right? System health, SQLs, right? All sorts of checklists. It just really depends on what we're trying to aim for. So we just look at that one on page 230. And so we said we want to prioritize target behavior and identify as excess, deficit, or poor timing, bad stimulus control. Why would poor timing be a thing for bad stimulus control? What does time have to do with controlling your stimulus? Yes, Lord.
I see in like most of what we're talking about, timing is kind of everything. It's like you can have the perfect plan, but if you give them a reward or the punishment 3 weeks late, it means absolutely nothing. So like you always have to time things within a window of effectiveness.
Yeah, absolutely. If you're saying, hey, things are on a schedule, it depends on the schedule, is either how people respond to things, right, negatively or positively in some sense. Antecedents and consequences, right? Why do we believe the thing occurs? What are the conditions to make that stimulus actually happen and occur? And what are the consequences? How bad are the consequences for the behavior? Sometimes it turns out the behavior doesn't have really bad consequences. Just be like, we just don't like it, right? You're like, well, that's an internal thing, you don't like it, but in an outward sense, dealing with others, consequences may not be as bad. Most of the time, the consequences are worse than what we believe they are, because we're kind of our worst judge, right? Personal judgment usually has a lot of bias, as you're talking about yourself. Most people don't feel comfortable being honest about themselves, right? Other people have to kind of tell them about themselves. Because of our ego and our ability, we want to try to cope. And so we'll use all sorts of defense mechanisms in order to negate the consequences. Right? We'll say they're not that bad. Immediate consequences more powerful than delayed, right? We say immediate consequences are bad. If there's things that, hey, in the next 20 minutes could be potentially very, very bad, that's a big issue. So think of it was, let's say someone has a sexual behavior, promiscuity. They would say, hey, you know, if you're very promiscuous with unprotected sex, you have sex with the wrong person, immediately to have severe consequences, either pregnancy, herpes, sexually transmitted infectious disease. Oh, you know, can't get rid of that, right? There's something you can't change immediately. Other things we could say, hey, you know what, if you don't stop smoking, you might develop cancer, right? But you got some time. Well, you could buy some time before it gets really, really bad, right? So some things come a lot quicker than others, right? So here we're talking about dieting, exercising, drug use. Yeah, you're overweight and you gotta do better, but you still have a chance to turn it around with diet, exercise, drug use, right? we say, hey, don't stop using drugs, something bad happened, but, you know, use it for a little bit. Dramatic consequences more powerful than subtle. So we say, are people who are able to correct their behavior in terms of neuroticism, PTSDs, right? We look at mass shootings, right? People playing out fantasies in their head about martyrdom, right? Wanting to make a name for themselves, or looking at excessive violence and trying to manifest the same or mimic the same sort of behaviors. We say those have steep consequences because it involves other people, and usually other people get hurt very quickly, right? You're gonna hurt other people very, very quickly. All right, and how to record responses. Remember we say, hey, Dr. Ossie, I see, okay, in my paper I wrote this response. Interesting, what do you think the intensity of this was? Moderate, severe, right? I think I've observed a mild case of something. I think I've observed a moderate case. It seems pretty moderate, seems usual, normal. Or anyway, I think I've observed something very bad. It seems like a severe issue, right? What's the intensity? How long does it last, right? Or how frequent it happens, rather, right? The rate. Like that happens every day, every hour, every 2 weeks, every month. Duration, how long has it been going on, right? Going on 2 years, 3 years, 6 months, what have you. Then we're using time sampling or interview recording for frequent behavior. So we're making an observation of a child. We're sampling time. We're recording, okay, it happened right here, this time, 11:37. Kid did the same thing at 11:45, right? So we can see how frequently this is occurring. Then we're looking at certain times of the day. We're looking at a select block of time and counting that behavior during that time period. Both these techniques have sampling problems. It's never gonna come up to be a perfect sort of arithmetic, I would say, in order to give you some sort of advantage or correct. Okay, let's end off here. Yeah, I'll put that more information about the presentations, but group 1 presenting next Wednesday, and each Wednesday after that. So I'll probably put the dates on Blackboard too, so everyone is well aware. And I will see you on Wednesday. Take care.